Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Geopolitical Ideas Lab, all on your time, live or on demand. This is CSIS Online.
Good morning and good evening. I'm Scott Kennedy, Trustee Chair in Chinese Business and Economics at the Center for Strategic and International Studies, and welcome to the event, Healthy Governance, Healthy Responses, Lessons from East Asia in Tackling COVID-19. The origins of today's event go back to last September, when we determined that CSIS needed to do more to look at the Indo-Pacific as a whole, instead of looking at individual countries and issues. Originally, we were planning to focus on security, but the pandemic intervened beginning in January, and so we've adapted out of necessity. We've shifted topics, and we've moved online. A silver lining to moving online is that it's expanded our ability to have a truly global conversation. We're delighted to have leading experts on public health and pandemics in particular from around the United States and from multiple locales in East Asia, including Singapore and Taipei. And we're delighted to have a live, online, global audience watching on YouTube. Before we get started, let me thank TECRO in the United States for its sponsorship of today's event, to our speakers, to my staff in the Trustee Chair, and to our partners in the Freeman Chair in China Studies at CSIS. And let me provide a little bit of context for the framework for today's discussion. As of this morning, the world reported almost 6.4 million total cases and 380,000 deaths due to the virus. But cases and fatalities are not spread evenly across the world like oxygen. They vary considerably, and I want to show you a little bit of data that we've assembled about this pandemic and what's going on. So we issued a small report last night, which you can find on the CSIS website, that looks at the variation in cases and fatalities around the world. And if we go to the next slide right now, you'll see that there is quite a bit of difference around the world. If we had shown you data in absolute terms, it would be even more stark. This is in log scale, so you can still see everyone together. And you can see from the number of cases cumulatively in several countries and jurisdictions from the first day they started reporting cases. And you can see how it's grown and how these curves are different in various places. But in addition to that, if we go to the next slide, you can also look not just at cases, but also at the fatality rate. And what we've got on the y-axis are per capita cases, cases per million in each country and locality. And along the bottom, on the x-axis, the fatality rates. And you can see we've highlighted several jurisdictions to point out that there's extreme variation. Some places have done really well in limiting the total number of cases, but they still have high fatality rates. Some places have low fatality rates and low cases. There's a whole variety of different kinds of patterns here. Obviously, your goal is to have a small number of cases and a low fatality rate. If you can have that combination, then you've really done a great job. Now, the question is, what explains this diverse pattern of outcomes? One reason might be demography. Certainly, this is a disease which is most dangerous for the elderly, and countries with a higher proportion of elderly have had more fatalities per capita. But that's not the entire story. So if we go to the next slide, a lot of people have talked about the importance of good governance. And we think that probably matters a lot, and it's why we've titled the event that we have today. But when we looked at data about general governance capacity, rule of law, other types of indices, they didn't really show any clear patterns with respect to the data on outcomes. So we went a little bit more granular and looked at data about specific ways in which countries have responded to the pandemic, looking at the ways that they've closed activities, limited travel, economic measures that they've taken, as well as actions by their health systems to increase transparency by providing information to publics and by collecting information from the public in terms of testing and contact tracing. And it seems to me that a combination of these actions have a lot to say about the results of countries' abilities to deal with this pandemic and to deal with future ones. So today's conversation is really oriented around the question of what is it about the domestic responses that have led them to be more or less successful? And secondly, we know that domestic interventions that are successful are also important for constructive international cooperation. And so we're going to have two conversations today. First, about domestic responses, and then have that lead into international cooperation and where we're doing things well and where we could do things better. And this will provide lessons not only for the region and for this pandemic, but for the rest of the world to not only deal with the current problems, but to make us even better prepared for future pandemics, which are definitely going to occur because that's the type of world that we live in. It's just impossible to stop them, but we can prepare and limit their damage as much as possible. So let me turn things over now to Jude Blanchette, my colleague at CSIS, who's the Freeman Chair in China Studies, and he'll introduce our keynote speaker. Jude, over to you.
Great. Thank you, Scott. And I'd like to also extend my thanks to everyone watching online and those of you in the future who'll be watching this in archive form. This is really just an extraordinarily important topic, and I am likewise thrilled at the diversity, geographic and otherwise, of the panel today to help us wade through some of these really challenging issues that are going to be with us for quite a long time. As Scott said, we're looking in today's discussion to be looking at the lessons and legacies of the coronavirus. But as it stands, many countries, including the United States, of course, are still battling COVID-19. And so this is really imperative that we engage in these conversations in real time about what's working, what's not, and what lessons we can learn. And I'm delighted to kick off this morning's discussion by turning the virtual floor over to Ambassador Stanley Kao. Ambassador Kao currently serves as a TECRO representative here in the United States. Prior to his current position, Ambassador Kao was Taiwan's representative to Rome from 2013 to 2016. And with more than 40 years experience in Taiwan's foreign service, Ambassador Kao has undoubtedly seen his share of domestic and global challenges. And so I can think of few people better placed to help kick off this important discussion on public health, governance, and what the world can learn from how East Asia and countries like Taiwan have dealt with this. And so, Ambassador Kao, I will turn the virtual floor over to you. Ambassador Kao, we got to, sorry, I think you're still on mute.
Can you hear me?
Perfect. There you go.
Wonderful. Yes. So once again, thank you very much for having me for that very warm introduction, Jude, and of course, very key update introduction by Scott. And indeed, it's a great pleasure for me to join this very timely discussion on countries in our part of Asia Pacific, tackle this COVID-19 pandemic, both respectively and collectively. But if I may have our special thanks to go to the impressive CSIS team, and for this long-standing strong partnership with our mission, TECRO, and hosting this very important event as a great follow-up for the inspiring conversation just a few weeks ago between my Deputy Prime Minister, Chen, and the Deputy Secretary, Eric Hagen, of the Health and Human Services. I will believe that when the going gets tough, the tough get going. And our generation faces one of the toughest public health crises in history. So it's critically important that we get together here in separation, but hopefully not in isolation, trying to figure out and work out best ways and paths forward. So as some wise people said, a good crisis is not wasted. President Tsai Ing-wen of Taiwan 2 weeks ago in her inaugural address for the second term in office, she said that since the beginning of the year 2020, Taiwan has amazed the international community twice. The first was our democratic elections, and the second, the success story in the fight against COVID-19. And indeed, since the outbreak, there's been no shortage of valuable observations and excellent analysis of why Taiwan, among a handful of countries in our region and around the world, has beaten the odds to control, contain, and combat the deadly spread. Outstanding and steadfast leadership, robust and proactive government response, public-private partnerships, and in all, we proudly present as the so-called Taiwan model. But keep in mind, most important, that by keeping the accountability, transparency, and mutual trust, of course, Taiwan, far from being perfect, made a strong case for good democratic governance and open society in response to such a massive health crisis. The Taiwan model has once again proven that it takes the whole village to join the fight, as the virus recognizes no borders and is indiscriminate to anyone. With the whole of government and whole of community efforts, we've been able to get a job done so far. And it's equally significant that the vibrant civil society comprise and support those initiatives, as we have learned those incredible, touching stories from PPE, surgical mask donations, app and AI development, specialized hotels and shelters, and to grassroots fact-checkers. Internationally, Taiwan is a capable, willing, and responsible stakeholder, stands in solidarity and spares no effort to give back to the global community. Our action speaks for itself, loud and clear. Yes, Taiwan can help, and Taiwan is helping. The government has launched waves of humanitarian assistance, donating almost 50 million high-quality made in Taiwan surgical masks and PPEs to the United States through FEMA, the federal agencies, to the state governments, and for the frontline medics and healthcare personnel, to the European Union, its member states, all our diplomatic allies, and neighboring partner countries, with no strings attached. And our citizens and NGOs also lock arms in gifting the world millions of masks and other assistance, taking to heart simply the spirit of helping others to help others, helping ourselves to help others. When we help ourselves, others will help us. So, ladies and gentlemen, despite the recent setback in our campaign for the observer status at the World Health Assembly, there was unprecedented sympathy and support from around the world. And please rest assured that, against all odds, Taiwan will continue to do the right things and also do the things right, and always punch above its weight to help as an unmistakable and a responsible actor. Taiwan's bid for meaningful participation and commitment to global health system remains unchanged and undaunted, as more countries see the merits, necessity, and urgency of Taiwan's indispensable participation and partnership. Once again, ladies and gentlemen, this pandemic is far from over. and we must stay vigilant and not take anything for granted. And even when it ends, certainly better sooner than later, and better late than never, its impact will linger on. The coronavirus has profoundly affected our world, has changed the global political, economic order, accelerated and expanded the reorganization of global supply chain, and changed the way we live, work, shop, hug, and in my case, watch baseball and play tennis. And for Taiwan, it is no doubt it has changed the way international community views the island and nation and its 23 million men and women. So I look forward to today's all-star panels and your most stimulating and enlightening discussion. Thank you very much, Jude.
Great, thank you, Ambassador Kao. And I agree, this is something that's going to be with us for a long time. Certainly, the legacies and profound lessons from this, and we can, I think, help contribute to that conversation by the two panels that Scott and I have organized today. The first one, which I'll be moderating, which will begin momentarily, we're going to look into some of the domestic responses from countries around the region, and then Scott will be talking about international cooperation possibilities. I should hasten to add that for viewers, if you'd like to ask a question at any point during the two panels, if you go to the csis.org/events, you'll see a link for this event, which is Healthy Governance, Healthy Responses, and there's a link where you can ask a question. And if I could just ask anyone who's not speaking, who's on the panel, if you could just mute yourself, just so we don't get any background noise, that would be appreciated. Well, great. Well, until about 9:10, we're going to be having a discussion with my esteemed guests here, which really give us a great breadth to look into individual responses in countries, what works and what hasn't. In the interest of time, I'm actually just going to read the current title of each of my guests, because reading their entire CVs, which are extraordinarily impressive, would take most of the rest of the program. So in no certain order, I'm really pleased to welcome to the virtual floor Professor Zhang Shangchun, who's the convener of the advisory specialist panel of the Central Epidemic Command Center, which is associated with Taiwan's CDC. Yiking Teo, who's the dean of the Sa Sui Hawk School of Public Health at National University of Singapore. Dr. Jennifer Bui, who's the Tong Chair in China Policy Studies and a senior policy researcher at Rand Corporation, and my colleague Victor Cha, who's a senior advisor and Korea Chair here at CSIS. We thought we'd do is we'd just go down the line and ask each of the four panelists the same question, and it's pretty open-ended. It really is just to give them each a chance to dig into exactly what lessons and examples that they see as being most apposite for this discussion here. And the question simply is, what explains the success or lack thereof of East Asian countries' handling of the pandemic, and what lessons are there for others? And so speakers are welcome to compare several countries or just discuss one particular country. And in the interest of time now, I'd ask if the guests could just keep their remarks to maybe 5-ish minutes. So can I start with Professor Zhang Shangchun? Can I ask you to kick off this discussion? What's working, what isn't, and what lessons are there for the rest of us? And again, just to remind everyone to, when you start speaking, please unmute yourself, and when you're done, please just please put yourself back on mute. Professor Zhang, turn the floor over to you.
Okay, thank you very much. And good morning and good evening, everyone. And first, I will present some our experience in response and control of COVID-19 in Taiwan. Next. On December 31st last year, Taiwan CDC noticed some online message mentioned that there had been at least 7 cases of atypical pneumonia isolated in hospital in Wuhan, China. Therefore, they sent email to China CDC asking for further information and try to confirm if it was a new epidemic disease. In addition, they started to implement onboard quarantine of flights coming from Wuhan at the same day. We also established a response team and conduct the first response meeting on January 2nd. On January 5th, we held an advisory committee meeting and established reporting criteria for suspected cases. When China announced the causative etiology as a novel coronavirus, we issued a travel alert for traveling to Wuhan. In addition, we established laboratory diagnosis protocol as soon as the genetic sequence of the virus was released. On January 5th, we listed the disease as a notifiable disease according to our Communicable Disease Control Act, and every healthcare worker, if they have met this kind of patients, they have to report it to our Taiwan CDC. A few days later, the Central Epidemic Command Center was activated on January 20th. A few days later, President Tsai of Taiwan held an emergency meeting of the National Security Council on January 22nd. That was before the WHO declared COVID-19 as a public health emergency of international concern on January 30th. This means all our actions are started very early. Next slide. Since the first case was confirmed on January 21st in Taiwan, more than 72,000 suspected cases were reported to Taiwan CDC and tested for COVID-19. Till now, totally, we have 443 cases confirmed, of which 55 were locally acquired, 352 were imported cases, and 36 were cases of an outbreak from a naval battleship. The slide shows the data of 2 days ago. We have one more new imported case yesterday. Most of the imported cases were from the United States and European countries. So far, only 7 cases died from COVID-19 in Taiwan. Next. This slide shows our strategies for COVID-19 control during past several months, including enhanced surveillance, set up laboratory diagnostic network, impose border control and home quarantine, conduct case investigation and contact tracing, strengthen medical response, ensure PPE stockpile and distribution, implement social distancing, engage the public through communication and counter disinformation, initiate research and development, and also try to expand international collaboration. Next. First, for COVID-19 surveillance, we established the surveillance system specifically for COVID-19 very early, using our framework for communicable disease surveillance. Under that framework, we have indicator-based and event-based surveillance systems. Regarding the indicator-based surveillance, we gather data from national notifiable disease surveillance, quarantine at the airports, syndromic surveillance, cluster reporting, as well as trend monitoring for influenza-like illness and acute respiratory infection. For event-based surveillance, we gather information from international agencies such as WHO, European CDC, and social networks such as Framework Twitter, and also Taiwan CDC monitor the media reports every day. Next. This slide shows since January 5th, when COVID-19 was listed as a notifiable disease in Taiwan, the scope of surveillance has been expanded according to the progression of the epidemic from Wuhan, Hubei province, Guangdong province, Zhejiang province, and even whole China, and now to all inbound travel with suspected symptoms. Starting from March, patients with community-acquired pneumonia or unknown etiology, healthcare workers with pneumonia need to be reported to public health authority for testing of SARS-CoV or COVID-19. And from April, all healthcare workers with fever or airway symptoms need to be reported and tested for SARS-CoV-2. We continuously extended our scope of surveillance during past several months. Next slide. We have a total of 43 designated laboratories for testing SARS-CoV-2. Currently, our lab diagnostic capacity is more than 5,800 tests per day. The capacity can be double, triple if necessary. The slide shows the number of tests each day during past 4 months. Next. For border control, we issued the first Level 3 travel alert on January 21st for Wuhan, advising avoidance of all non-essential travel, which is quite early. Through our risk assessment, which was conducted regularly, we also set travel restriction, such as entry or transit restriction for inbound travelers from different regions or countries at different stages of the epidemic. By March 21st, Level 3 travel alert was issued for all countries, and by March 24th, we also prohibit transit through Taiwan airports. Next. Inbound travelers were required to make a health declaration. They have to go through fever screening and health assessment. Travelers with sign or symptom related COVID-19 within the past 40 months will be tested and quarantined for 14 days in group quarantine facilities. For those tested positive, they will be put in negative pressure isolation room in designated hospital. Other travelers will undergo home quarantine and will be actively monitored once or twice a day. Next. This slide shows our quarantine policy. All inbound travelers or close contact of confirmed cases would undergo home quarantine for 14 days. All were required to stay at home or in a designated place. Local civil and health officers would actively monitor quarantine person once or twice a day. A digital tracking system was used to track those quarantined people through mobile phone. And local governments in different cities or different counties also set up centers for consultation and supporting services, including transportation and medical arrangements, household services such as meal delivery, garbage collection, and counseling. To compensate for lost wages while staying at home, the government provided a supplement of $33 per day for 14 days for those quarantined people because they could not go to work. All this help us very much to ensure all those people need to be quarantined really stay at home. Next.
Dr. Zhang, can I just ask, if possible, just if we could just wrap up relatively quickly so we can make sure we can get to all the other speakers. Thank you.
Okay, thank you. And of course, we do a very diligent case investigation and contact tracing. And this is just, I think everybody knows is very important. And also the medical response, we have some designated hospital that was established since SARS outbreak in 2003. And this designated hospital was activated and treated most of the COVID-19 patients during this pandemic. So we take very good care of all those patients, and we have very low case fatality rate. And next. And this shows our PPE stockpiling. And initially we can provide only not very much face mask. That means the daily production of face mask capacity was about 2 million pieces per day in late January. And our government cooperated with the different companies to increase their production capacity. And in May, now we can have produce about 20 million pieces per day of face mask. Therefore, the healthcare worker in our hospital always have adequate amount of PPE and face mask. In addition, we have a very special design system to improve the distribution of masks, which was a name-based distribution system for the general public to purchase masks, and we maintain a very low price for public to acquire the face mask. Next.
Dr. Zhang, I'm apologies. I'm going to have to ask that we leave it here, just because we're already more than halfway through the program. So maybe we can, if we have time at the end, we can come back around to some of the final thoughts. But I want to make sure I leave sufficient time for all the other speakers. So
okay.
So we'll leave it there. Thank you very, very much. And again, a reminder, when folks are done speaking, please put yourself, click the mute button. So thank you very much. That was really quite comprehensive look at many of the actions that Taiwan was taking throughout the entire process. I'd like to now turn this over to Professor Teo to get the view from Singapore. And Professor Teo, I'd like to put the same question, open-ended question to you, which is either from the vantage point of Singapore, what's working, what isn't, and also feel free if you want to remark on some of the experience of other countries. And again, I have to just ask that folks try to keep their remarks relatively clipped here so we can make sure we've got sufficient time for Q&A. Professor Teo, over to you.
Thank you, Jude. I hope you can see my slides.
Yes, we can.
Great. So I will just show about 4 slides, and I will take about 5 minutes. And I want to thank Dr. Chang for really going through the in-depth response of what Taiwan did, because it saved a lot of effort on my side. But what I would like to discuss is really what worked in regions like Singapore and in Taiwan, and why did it work? And I think the first context that I want to talk about for Singapore is really we had our opportunity, a painful opportunity, to learn about coping with an outbreak in the country in 2003 when we have SARS. So Singapore, as you could see from this chart, was actually one of the countries with quite a significant impact from SARS, where we had 238 cases, of which 33 unfortunately passed on from the infection. And based on that, we started learning about what it's necessary for the country to put in place a response that will cope when there is an outbreak, particularly an outbreak that require hospitals to get its act together very quickly, and also the the vast majority of the people in the country to respond in a particular manner. So this is a very quick snapshot of what's currently happening in Singapore right now. And across the horizontal axis is really the time axis, starting from the middle of January all the way to yesterday. And you could see that the top panel, which says total, the numbers were very, very low all the way until perhaps the beginning of April. And our first wave was actually introduced. You could see a little blip in the last panel at the bottom in January, which was importations from travelers coming from China. And really, the community cases that we had in Singapore really took off only from the middle of March. And you could see what was driving those yellow curves is actually the red curves at the bottom panel. Again, people coming back from overseas. And so Dr. Chang, when he went into the details of the border control measures that Taiwan put in place, it's very similar to the border control measures that Singapore put in place as well. But unfortunately, as you could see from the third panel that says migrant workers in dormitories. So this was what led several media outlets to change the tone for Singapore from being a gold standard country with a gold standard response to a cautionary tale. Why cautionary tale? Because we saw the infection, the COVID-19 infection, enter the migrant worker dormitories. And because of the living conditions in those situations, the infection actually spread very quickly. That became a lesson that we hope the rest of the world will learn from, because in many countries there will be communities where perhaps because they are living in slums, the density of people living in one household unit is actually very high. And we know for a fact those are the conditions that makes COVID-19 very susceptible to be transmitted in a widespread manner. 3 key principles that Singapore adopted all the way since January up until now. The first principle is really very aggressive testing, very active case finding to find people who have been identified or who have been exposed as early as possible. So you actually remove these people, you isolate and you quarantine them. The second is really national measures that we put in place that were guided by science, by mathematical epidemiological models, by best advice around face mask, around isolation, quarantine, social distancing. Those were advised by scientists, not just from the public health arena, but also from the medical experts. Because in Singapore right now, we actually isolate all infected people in government facilities. That means that if someone is infected, and even if they are very mild, suffering from a mild infection, they don't get to go home. They are watched over in a government facilities for about 14 days until their symptoms improve. Then they are discharged in many ways. And that means that we don't take chances with people who are infected. And those are all principles that are guided by science, guided by evidence. And the third has to be the communication strategies. From the very beginning, the government managed this very strictly and have one single trusted source that communicates very clearly the current situation in Singapore, the national regulations, because the outbreak is evolving very quickly. There are new rules, be it about border controls, be it about social distancing, be it about workplace closures, school closures. All of these national regulations needs to be communicated timely, clearly, transparently. And that is where the communication strategies have worked very well. And lastly, it is really about what are the personal actions that individual can take to protect themselves and to protect others in the community. And that has been very much a very successful response that I see not just in Singapore, but it is the hallmark of response in many East Asian communities. And this is my last slide, because I want to mention that there are commonalities in strategies, in public health strategies. Worldwide, we see there is safe distancing. Worldwide, we see there is this face mask wearing. But there are very important differences and nuances that I think is useful to flesh out. There are 5 contextual elements that I think is worth talking about. Historical is one, because for regions like Hong Kong, South Korea, Singapore, China, Vietnam, regions that so far people think that we have done pretty well, we had our shared experience, whether it is in SARS, whether it is in MERS or in H1N1. That led the the public healthcare system to put in place the necessary responses to cope with an outbreak. Second is really around social and cultural. East Asian communities in general tend to have that more communal, community-spirited element. There is that trust between each other, that I take care of myself to protect myself, my family, and others in the community. And that, I believe, is what sets apart East Asian responses from many other regions. The third is really around capacity and capability on testing, tracing, isolation. I wouldn't go through too much of that. I think we all know that very well. Economic measures. What are the fiscal response to protect livelihoods? Again, I won't go into detail. But the last element that I think is worth highlighting is the political context. Because many governments in East Asian countries and regions tend to have the benefit, in some other worlds they may see it as detrimental, the benefit of having stable, perhaps single or at most two parties running the country for an extended period of time. And that means that the government that is in control, the politicians that are in control, they are able to put in place long-term investment in health, in public health, with a long-term outlook. They are not looking for short-term gains to gain that popularity, to make sure that they are re-voted in the next round and so on. And I see this political context as, again, a very important element that sets apart East Asian societies from the rest of the world. And with that, I think I will just stop there and we can come to that more discussion later on. Back to you, Jude.
Great. Thank you, Yiking. That was really fantastic. I appreciate that. Dr. Bui, I'd like to turn the floor over to you. Same general question. What, from your vantage point, I know you've done a lot of work in looking at China's public health system, but want to get your take on looking across the region, what is working, what isn't, and what lessons are there for the rest of us?
Great. Thank you very much. Well, thanks for CSIS to inviting me with many distinguished guests and experts. I'm a epidemiologist, so I like to look at patterns. So I will use my 5 minutes not focusing exclusively on China, although I can answer more questions on that later on, but really just to look at the patterns across look at the countries' management styles across the Asia countries. So as we have seen that the COVID-19 is certainly a public health crisis with unprecedented impact on people around the globe, both on our lives and the livelihood. It started in Wuhan, and then in February, our attention was attracted by Korea and some of the East Asia countries. But by March, the epicenter had moved to Europe. And in April, certainly U.S. has been leading the chart. And right now, we're looking at Latin America seems to have a increased accelerated rate in the new cases. So East Asia, I would say overall are doing very well. Many countries are looking forward to their experience, to emulate their experience. So at RAND, in April, we hosted this event and bringing in 8 ambassadors and consul generals to talk about their countries' the lessons learned and their success and their challenges. So I was moderating that event. What I feel is that there's certainly not a one-size-fits-all recipe there. In East Asia, we have countries with very different culture background, very different governance style, and also very different experience in the past. So, but there's a bottom line seems to focus on the institutional capacity before COVID-19, and also the social cohesion, as well as the governance style. So as my panelists just mentioned, the early detection, early action, and what I contribute as a TEA, the transparency, efficiency, and agility, those all contribute to the success of the East Asia. Well, first, I want to highlight 4 points in the next few minutes. The first one is the pre-existing capacity. So as Professor Teo just mentioned, many East Asia has been hit by multiple coronavirus in the past 10, 20 years. China, Hong Kong, Vietnam, Taiwan, Singapore are all hit by SARS 18 years ago. And that was a wake-up call for many of these countries. And I would also like to highlight Korea, which was hit by MERS in 2015. And afterwards, they really revamped their Infectious Disease Control and Prevention Act. And that law provide a legal framework to identify the Korea CDC's role, as well as the role for the local government as well as the private industry. So once the COVID-19 hits, everyone know their role in a pandemic response. They also earmarked the funding to maintain a healthcare worker, public health worker capacity, and that's important. And finally, they also looked at using the technology to do the disease tracing, and they obtained the consensus to do that in the pandemic. So I would say a pre-existing playbook, pre-existing capacity, and experienced workforce is important. And secondly is the social cohesion, as mentioned by other panelists. Not only people are acceptable of wearing face masks, and also watching each other in a way there's a peer pressure about following the quarantine rules. But the government also provided very clear transparency and clear source of information. They also, both in Taiwan and Korea, they looked at the specific instructions on where to get medical supply and the limits of medical supply each person or each family can get. So that's a very good organized way to deal with the limited resources. And the hospital bed, the telemedicine, and looking at different severity levels are also helping to map the limited hospital capacity. And also the third point is travel. I think the one thing is lucky for many of the East Asia countries that when COVID-19 first hit, the sources are pretty much all coming from China and limited countries. So they can very targetedly looking at the travel restrictions on those countries. And again, the previous experience helps that they understand the effectiveness of the travel efficiency only when the travel restriction coupled with testing and tracing. And then finally is the innovation and manufacturing capacity that is very advanced in East Asia. So we have seen lots of these tracing apps and technology in Taiwan. The electronic medical information has been used, linked to the telemedicine. So all of these technology has been in getting the national investment. And I think all of these will help these countries to cope very well in this unprecedented crisis. So I will just stop there and happy to answer more questions.
Great. Well, thank you very much, Jennifer. Those are really great and helpful comments. Now I'd like to turn to my colleague, Victor Cha, who holds the Korea Chair at CSIS, has been doing a lot of writing on how South Korea has been dealing with COVID-19, but also been looking out across the region. So, Victor, same general question to you. Won't hold you to talking about South Korea explicitly, but want to get your thoughts on what's working, what's not, and what are the lessons for the rest of the world, and especially the United States right now.
Well, thanks, Jude and Scott. In my 5 minutes, I'll be, I think a lot of the things about the South Korean case have already been said. The lessons from the South Korean case have already been said. So, very quickly, let me just say that, one of the things we saw from South Korea was that, like many other countries in the region, they moved quite early in terms of declaring a national emergency. They placed a premium on speed, moving as quickly as possible. I mean, 9 days after their first case on January 20th, they established a national call center. 2 weeks after the first case, they started rolling test kits off the production line. So a premium was placed on speed. I entirely agree with everybody who's talked about the role of preparedness and learning that took place among all these communities in the aftermath of previous coronaviruses. I mean, as Jennifer said, in South Korea, it was certainly the case with MERS in 2015, SARS in 2003. I found it, Jude, as you know, I actually work mostly on national security, but when I started reading some of the after-action reports of ER doctors in Taiwan and Singapore and South Korea after MERS and SARS, it's amazing how much it sounded like what we're dealing with in the United States in terms of lack of PPE, frontline healthcare workers being 50% being infected, setting up isolation beds in parking lots. And I think that was a searing experience for all of these countries and communities that led, as Jennifer said, to changes in legislation. And I think most importantly, a demand on the part of civic society for governments to be immediately transparent and open about all the information that was available, even if that meant changing legislation, and even if that meant some invasion of civil rights, privacy rights. And I think that was an important lesson. And then the fourth thing, I think, at least in the South Korean case, I think that we see across cases when we compare it to the United States is the role of the national government in leading from the front and not just from behind. And in the South Korean case, we saw this in particular in the way health authorities brought together public and private sector, calling on the private sector to increase capacity while calling on the public sector to ensure expedited regulatory approval of things. We saw it in PPE, right? The stockpiling of PPE, the DS system, the designated COVID, non-COVID systems in Korea. So the point here more broadly is that, here in the United States, we had a very different view of what the federal government should do compared to state and even cities, whereas I think in many of the other places, the national government led from the front and not from behind. But I wanted to try to think of two things that we haven't talked about in terms of lessons learned and listening to the others, and I just wanted to mention two of them. It's come up in some of the other presentations, but I wanted to mention two of them when we think about lessons learned, and one of them is the whole role of digital tracking or digital tracing and what it means and how it's viewed in these communities versus in the West. On the whole, these have been widely accepted, although people use different types of, so what they use in Singapore is different from what they use in Taiwan, is different from what they use in South Korea. But these things have not been wholly adopted in the West, although Australia and France and other countries are experimenting with it now, not really adopted at all here in the United States. And, so I think that's one of the questions, like how important is this as a tool, particularly when we're talking about contact tracing, in the absence of contact tracing and reopening in the absence of a vaccine or a national testing regime here in the United States. In the United States, my understanding is that if you have one positive case and you contact trace, you test around 6 people with regard to that one positive case, whereas in South Korea, for one positive case, they test 45 people, which gives you a sense of the efforts at containment. And then the role of civic trust. I mean, as has been mentioned, because of SARS and MERS, there's a level of I don't know what's the right term, demand on the part of the public for transparency of information, and if that's provided, then societies feel compelled, to comply with, whether it's quarantining or other sorts of things. But there has to be trust in the information being provided by the government. And then the broader question of to what extent at least open societies can create enough safeguards for the use of this sort of technology with regard to privacy rights. Finally, moving beyond responding to COVID in terms of the pandemic is the economic questions. I think one of the cases that lessons that South Korea shows is, they are very deeply in the middle of the effort to recover economically from COVID-19. They just announced this week a $29 billion supplementary budget. It's the third supplementary budget this year, unprecedented for Korea. And so the question, I think, for a lot of these other cases is, what sort of extraordinary or unprecedented economic measures are they going to take to come out of the crisis? And to what extent can they use all of that supplementary money as an opportunity? So in South Korea's case, they're not simply just trying to create any jobs. They're trying to create more jobs in digitization of industry, promoting more online industry like telemed, 5G, AI. So they've tried to use it to push into another realm, a higher value realm on the production chain. And so to what extent can these post-COVID economic recovery packages provide those opportunities? So, Jude, I'll leave it at that.
Great, thank you, Victor. And actually, could I just stay with you for another minute or two? And just with an eye on the clock, we've got about 10 or so minutes because we want to start right at 9:10 with Scott's panel. So I've got a few questions that have come in, and I also am going to intermix some of my own for the panelists. But just ask that folks try to keep their responses relatively brief. Victor, in some of the writing you've been doing, you've touched on this issue of what role or not this idea of kind of culture in East Asia plays. And you just talked about this on I think, related to some of the surveillance issues. But I wanted to see if you could disaggregate or unpack a little bit a narrative of that there's somehow cultural traits in East Asia which make citizens there more willing to accept some government surveillance or more communitarian in a sense. And I want to see if you can, how helpful is that as a factor in understanding success, or are there other better explanations in governance per se, or sort of government's performance that explain that?
Yeah, it's a great question, and personally, I push back against sort of, and I'm very interested to hear what other people think about this. I kind of push it back against sort of the reflective sort of, there's a more of a communal cultural trait in Asia that makes them more willing to undertake these sorts of digital tracing apps. I mean, I think for one, I push back against the notion that these societies in Asia are less free than the ones in the West. I think a Trump official once said that like Korea and Taiwan were not free countries. That's why they could do this sort of stuff, which is just kind of hilarious. I mean, but secondly, it's empirically, it's not true. If you look at the cases it is not true that democracies cluster around higher cases of COVID while non-democracies cluster around fewer cases. It's just empirically incorrect. But I think there may be an element to it, but I think a lot of it again has to do with the experiences, as people have talked about with regard to SARS and MERS. And again, these left searing impressions on society. I mean, when SARS was tearing through Hong Kong, I mean, it was just freaking people out, and it left such an impression that it affected everything. It affected production capacity, legislation, all these sorts of things. And I think it's not so much communal as much as I think it is, as a result of those experiences, an expectation on the part of civil society that governments should do much better when these things come around. And if they are willing to do that, societies are willing to give up some of their privacy rights, and they're willing to comply with the directives. But the key is that sort of civic trust. And so I think that has been established in many of these cases, and clearly that's absent in the U.S. right now. We don't know who to listen to right now. The silver lining, one hopes, is that we will see the United States better prepared for the next one, because I think, as somebody mentioned, or someone had a graphic up that showed, I think there were like 24 cases of SARS in the United States, or I don't even know if there was a case of MERS in the United States, or 2 cases of Ebola in the United States. So it didn't even move the needle here. And so I think that has big impact on, I think, the way we think about it. Also, as Australia, France, all these other countries that jealously guard their privacy rights, or that are rugged individualists. I mean, these countries have all started to at least experiment with some of these apps as well.
Great, thank you, Victor. Yiking, I wonder if I can turn to you for a second. As I was listening to your presentation, I was beginning to think that when you look at how, especially how countries are talking about, quote unquote, what worked and what didn't, oftentimes there's a laundry list of actions taken and then overlapped on outcomes. And I'm curious, just from sort of epistemological standpoint, what conversations are happening within the Singaporean government or within academia of understanding how do we map on action with causation, rather than just we took a bunch of actions and we had good outcomes. How are you disaggregating that for the next time this occurs, focusing on the actions which were more effective than others?
So that's a very good point that you raised, and I will actually answer that by talking about the migrant worker situation, because that was one of the tinderbox that really led to a significant increase of the infection numbers in Singapore. And when that happened, if we look at what the Singapore government did, the first thing that they did was actually to consult the public health experts, to consult architects around the design of dormitories. And they were looking at how do they put in place a system that will now minimize the risk of infection. So this discussion between academia, experts, whether it is public health, medical experts, social science experts, even AI, computer science experts coming up with codes for Trace Together, the application that allows people to contact Trace very quickly using a digital platform. They were seeking advice from these academics that were able to provide information. And the academics were working overtime, because there were people in my faculty in the School of Public Health that were working on mathematical models to very quickly look at, should schools be closed based on existing data? What should the workplace system, should we shut down workplaces or advocate social distancing? How do we bring down the reproduction number? And when we hear about our ministers, who are not mathematicians, not epidemiologists, talk about the epidemiological curve, talk about the reproduction number, I had the impression that they were very well briefed. They were very well informed by the experts. And so that really highlights the difference that we see in terms of what makes a response very sufficiently strong that is dependent on science and evidence. And I have to say that that has been the hallmark for some of the countries that we have seen done very well in terms of whether it is Singapore, whether it is regions like Hong Kong. I know Hong Kong has an outstanding epidemiologist, Professor Gabriel Leong, that has been advising the government as well. And perhaps using this platform, I would just seed a thought. When Singapore had SARS, when Singapore had H1N1, we actually consulted public health experts from the United States and from the United Kingdom. And equally, last year, the Economist Intelligence Unit published a Global Health Security Index that was specifically looking at pandemic preparedness. The USA ranked number 1 in terms of pandemic preparedness. The UK ranked number 2nd. And the question really comes to us, especially in terms of experts working in this field. What went wrong when the world was looking to America and UK experts for consultation, for leadership, to guide us through pandemics? When an actual pandemic struck, it was somewhat disappointing that the response in UK and US were not up to the standards that we thought they should have been. And I'd say leadership at the heart of this. So over back to you, Jude.
Thank you, Yiking. Appreciate that. And we just have a few minutes left. Jennifer, I'd like to turn over to you for a moment. And again, just cognizant we're wrapping up soon. So big question, but I wonder if I could get you to answer it relatively quick. And I do just want to touch on China for a moment. I was reading your really good testimony before the U.S.-China Economic Security Review Commission, which is a really good granular look at some of the public health things that worked and what didn't. And I was struck by your comment on China's CDC which I didn't know much about the bureaucratic organization of it, but just in particular, you talked about how it's dwindling funding, lack of effective communication with local healthcare and government, and lack of legal and political power arguably contributed to the delay and some of the early bungling in China. So I'm wondering, in terms of lessons learned and the way forward, what is the state of discussion right now in China in terms of how do they modernize again their governance and public health institutions to be able to more effectively deal with the next crisis? And politically, is that possible given how much control that the Communist Party is leveraging over the bureaucratic system? Sorry, big question. Can you answer it in 2 minutes? Sorry about that.
I can give a lecture on that, but I try to shorten it. Certainly, I cannot speak for the Chinese government. So just based on my observation, as you mentioned, I already talked in my testimony that's in public. We talked about the capacity that China has built after SARS. So SARS was a wake-up call for China, and they have put in quite a lot of investment in the hardware, in the surveillance system, in restructuring CDC. They also received a lot of help from U.S. CDC all through these years. And by 2013, H7N9, China already showing that with U.S. CDC's help, they can design a vaccine. They can use their surveillance system effectively. However, this time we see a very similar pattern of the early chaos, similar to SARS. So I want to distinguish, a follow-up on Professor Teal's question. There's a difference between capacity and the capability. So even when we have the hardware capacity there, how the government can use this capacity to build up the response is still in question. So I think, just like many other countries, I'm sure China is reflecting on their response. And certainly the things that you just mentioned, the role of CDC, do they have the capacity or legal capacity to make actions, or are they only providing some advice to the local government and central government? And often in these pandemics, especially when it's not clear, the government has many other priorities other than the public health. Can public health put in their voice in that? How vocal they are and how much they can do is really based on the consensus in that country and the legal system. So I think we have talking about this. I do think that even with any government will be taking the COVID-19 very seriously and will reflect on that. I'll just stop there.
Great, thank you. And unfortunately, just looking at the clock, we're right at the marker where I've got to be a respectful co-moderator here and turn it over to Comrade Scott Kennedy, who will be moderating our second panel. So I want to just take 20 seconds to say thank you very much to the four panelists here. I think there was really some great conversation here. This is really just the tip of the metaphorical iceberg, and a lot of these discussions will go on, including looking at how differing governance regimes affect outcomes. That's one where we seem to have a governance failure and success comes in lots of different flavors, but I suspect over the coming months and years we're going to be able to learn more about what regime type means for outcomes. And what are the lessons learned. So thank you, everyone. And with that, I will turn it over to Scott. Thank you. Scott, you're on mute.
Okay. Well, thank you, Jude, and thank you, everybody on the first panel for extremely helpful remarks. I think we've made a lot of progress in identifying some commonalities and why there's been success, and also some of the differences and variations as well, and things we can reflect on. I want to focus now for the remainder of the program on international cooperation And because obviously this isn't addressing a pandemic isn't something that countries do alone. It's not something that only governments do. You need international cooperation between governments, health experts, pharmaceutical companies, other nonprofits and foundations, and many others who are part of this. And so I want to have the conversation, try to address these type of questions about what's worked, where could we do more to cooperate. And we have 4 fantastic, distinguished experts to lead this conversation with us this morning or this evening, depending on where you are. Let me very briefly introduce them. The first is Dr. Tiki Pangetsu, who's a visiting professor at the Lee Kuan Yew School of Public Policy at the National University of Singapore. Even more important than his current title is his previous one, where he was Director of Research and Policy Cooperation at the World Health Organization in Geneva, where he worked for 14 years. Our second speaker will be Barbara Marston, who is the head of the International Task Force for COVID-19 for the U.S. Centers for Disease Control and Prevention. She's led their task force for COVID-19 and has overseen a team that coordinated the CDC's efforts related to responding to the Diamond Princess cruise ship. She's the Deputy Director for Science and Program in the Division of Parasite Diseases and Malaria. Dr. Marston has worked on a wide range of international public health issues over many years, including HIV and Ebola. And we're really delighted that you could be with us this morning. Our third speaker will be Julia Spencer, who's Associate Vice President of Global Vaccines for Public Policy, Partnerships, and Government Affairs at Merck. In this role, she leads global public policy and advocacy to expand access to Merck vaccines and develops and guides policy strategy and tactical implementation programs to achieve maximum population health impact and business growth. Julia has more than 25 years of public health and health policy experience at the local, state, national, international levels. She joined Merck in 2014 as the lead for international vaccines public policy. Our fourth speaker will be my colleague, Steve Morrison, who's Senior Vice President and Director of the Global Health Policy Center at CSIS. Steve is an extremely busy person these days. He is a frequent commentator on U.S. foreign policy, global health, Africa, foreign assistance, and all things COVID-19, writing about domestic interventions as well as international cooperation. So this is really a first-rate, top-notch panel that I'm really delighted that all of you have joined us this morning. As we did with the first panel, I'm going to present just one general question to each of you, and I hope that you could use about 5 to 6 minutes or so to offer your initial reactions, and then I'll follow up with some questions, some that I've thought of myself, as well as those that those watching online are sending to us. And so that big question is, to date, what have been the strengths and weaknesses of international cooperation in responding to the pandemic? Feel free to discuss any number of issues, whether it's about information disclosure and sharing, coordination of travel restrictions, coordination of economic stimulus and limits on protectionism, manufacture and provision of medical equipment, and development of therapeutics and vaccines. And feel free to, if you want to focus on specific governments, the WHO, or other international organizations, foundations, medical workers, health equipment, pharmaceutical firms, the whole network of organizations and agencies that are involved in a collective effort. So I'm going to turn things over first to Dr. Pangetsu from Singapore. Thank you so much for joining us in this event.
Yeah, thank you very much, Scott. I'm just going to try and...
So we're going to put the spotlight on you, and we're going to take down this panel, but we can hear you.
Sorry, I'm trying to share my slides here. It says someone else. Okay.
There you go.
I think we are getting there. Can you see it?
Yes, indeed. Indeed.
Okay.
Wonderful.
Thank you very much. I'm going to focus, as requested, on international cooperation, but let me begin by perhaps giving you my view of lessons from East Asia, which is sort of the foundation of international cooperation. I'm going to be rehashing what many have already said, but perhaps with some takes on my own. I think, as already mentioned, speed of reaction and anticipation around extensive testing, isolation, contact tracing, social distancing, movement restrictions, etc., was certainly one highlight. Secondly, political will and commitment, strong, firm, decisive, evidence-based government action and directives, as YY Teo has highlighted. But let me just highlight also the fact that a lot of this was free from political interference. Third, good governance, where the institutions have a unity of action, purpose, and coordination at all levels, be it national, provincial, and even local. A very important point that's been made by many, a population which trusted the government, is compliant to directives, and place the safety of the community above self-safety. And I think Victor highlighted the last point is the effective use of artificial intelligence and digital health strategies as being another key lesson. So let me move on to international cooperation. I think it's needed for better governance and outcomes because, firstly, it strengthens international solidarity and trust through evidence-based guidance and standards for country responses to pandemics. Scott, I've chosen, as you sort of suggested, to focus on the World Health Organization, an organization I worked for 14 years of my career that I still passionately believe in, and unfortunately an organization which, as we all know, has come under unjustified recent attacks from a certain government in the world. So basically, I think to focus on the WHO, its value in international cooperation can be sort of gleaned by asking the question, what can it do and what can't it do? Okay, and I believe there are a lot of misperceptions about that that's creating some of the controversy. So let me begin by what it can do. What is it good at doing? It is good at setting norms and standards, international health regulation, public health emergency of international concern. It is good at clearing information, the global outbreak and response network, where every country reports unusual potential outbreaks. Thirdly, the neutral convener of independent expert scientific advice. That was very clear during the COVID, where the expert committee met regularly to advise the organization. And finally, to advise, guide, and provide technical support for countries. What a lot of people don't realize is what it can't do. First, it is not an emergency response organization to deal with pandemics. It cannot send 100 doctors, 100 nurses, 100 mobile hospitals halfway around the world in 24 hours. It's just not what it's meant to do. It cannot compel governments to release information. Very important. It cannot call out countries, criticize, or tell them what to do. It is not a global health inspectorate, in other words. And finally, it can't impose sanctions or punish countries for non-compliance. The second reason that international cooperation is important, because it is also needed for facilitating and accelerating the development and implementation of key interventions. As you know, a month ago, a major $8 billion initiative called the ACT Accelerator for the Global Response to COVID-19 was announced by the European Union. This is a very multi-organizational collaboration between the G20, the African Union, APEC, WHO, the World Bank, and the idea really is to focus across the entire spectrum of R&D, manufacturing, procurement, and deployment of vaccines, therapeutics, and diagnostics. This is a wonderful example of international cooperation. So let me just finish by saying that having worked for the WHO for 14 years, I'm a passionate believer in multilateralism and the value of international organization in cooperation in terms of strengthening collaboration and trust to deal with future pandemics. I'm the first to acknowledge that there are weaknesses, there are things that could be done better, but please bear in mind what former Secretary General Ban Ki-moon had to say. The United Nations did not exist to take us to heaven, but to prevent us from going to hell. Back to you, Scott.
Thank you so much, Dr. Pangetsu. That's a very helpful overview and framing. I'm going to turn things over now to Barbara Marston from the U.S. CDC. And obviously, Barbara, I think folks are going to would love to hear your reflections about international cooperation in the WHO. But of course, that's not all of international cooperation, and there's other aspects as well. So really, again, thank you for joining us, and look forward to your remarks. Turn things over to you now.
Thanks very much, Scott, and thanks for the invitation to participate. As is typical for these CSIS events, it's really been an interesting and informative set of presentations so far. And maybe just to reflect on your comment a moment ago about WHO, I think, Dr. Pangetsu explained the critically important technical role that WHO has in developing guidance, and WHO is a critically important partner from our perspective in terms of developing that guidance and sharing it. And that's been very apparent throughout this response. Before just touching on, I'm going to take a little bit of a CDC perspective on the international cooperation. And before I touch on some of the strengths and weaknesses, which was really the focus of the question, just want to acknowledge a couple of the key features that have made this response particularly challenging and that have made that international collaboration so critically important. So obviously, we've been able to apply, information about other coronaviruses, particularly in East Asia. That experience has been critical. But when this is an unfamiliar pathogen, and we need to learn, more, develop new diagnostics, and develop a rapid understanding about incubation periods and epidemiology, I think, international collaboration is critically important in that context. There have been some aspects of this virus, the coronaviruses in general, that have made this response particularly challenging. So, for example, the fact of pre-symptomatic transmission has really made it very difficult to design effective strategies. And I think, again, just points out the importance of sharing information about what has worked or what is known. And the third thing is that, because this is a pandemic, countries all over the world need the same things. They need the same supplies. And that means that countries that are typically in a position of supporting, other countries are, in some cases, very focused on their own response, hopefully not to the exclusion of supporting responses elsewhere, but it's been apparent to me, as reflecting on the international response from CDC, if you look at what happens in our emergency response meetings or our, incident management meetings, most of the focus is on the domestic situation. That's not to say that we're not deeply motivated and committed to support internationally, but obviously that, our attention is sort of split in that regard. I think a critical strength of the international cooperation, even though it hasn't been perfect, really has been the discovery and sharing of information about the pathogenesis or the epidemiology of the virus and the effectiveness of various control measures. It's been very helpful for CDC to have, sort of one-on-one or one-on-multiple conversations with other countries to learn about what works. Just this morning we had a teleconference with colleagues from Korea to better understand the phenomenon of testing positive again after somebody had been diagnosed with COVID at one point and then retested later. And that experience in Korea is very helpful to inform what we're doing, in the U.S. And there have been countless examples of that. We get together with different countries experiencing, outbreaks in the food processing industry, or to discuss what's going on in schools and what would be the most appropriate recommendations. And so that collaboration has been, very helpful. I think another critical strength of the response is that there's a baseline of capacity that's been developed through decades of preparedness work, but specifically over the past 5 years or so, there's really been an intensification of efforts to support different countries to be prepared for this sort of thing. And that doesn't mean that we're perfectly prepared or that countries are perfectly prepared, but I think it does mean that countries are better prepared than they might otherwise have been. And I think we've seen countless examples of that. From a CDC perspective, we're proud to see the impact that we think some of our activities have had on the ability to track and respond to the epidemic. So, for example, our keystone activity of training epidemiologists, the field epidemiology training program, where we've trained over 18,000 epidemiologists over the last few decades and accelerating numbers over the past several years. You can really see that the impact of those trainees and playing, in monitoring responses in different countries and playing leadership roles in different countries. Similarly, the work that we've done along with others to build laboratory capacity in different countries is really reflected in the ability of different countries to be able to make diagnoses or to support diagnostic efforts. And I think that's again, it could be better, but it's something that we really can be proud of. And similarly, I think our work to develop platforms across the world that can recognize respiratory viruses and diagnose and isolate respiratory viruses is also critical so far, but going to be critical. Some of those platforms for learning more and more about the virus and tracking this pandemic globally. And then I think just to point out that despite the need for the U.S. to focus on the response, there is a tremendous commitment to supporting the response in other countries, and that's reflected both in efforts to provide technical support in different countries, but also financial support. So I'm happy to say there's been, Congress has allocated very substantial resources. We've programmed a lot of that so far to try and support, things that CDC traditionally does. So surveillance and laboratory capacity. And despite the challenges, there have really been some important successes in that regard. And I think we look forward to trying to amplify those. From that perspective, one weakness has been that typically we support responses by deploying staff, and that's really been limited with the travel restrictions that are in place and with the need to focus domestically. But I think we've heard already how important it is can you get anything positive out of the response? And I think I'll just finish by saying, even though we haven't been able to do a lot of deployments, we're very pleased to see that some of the partnerships we've built up over the past years, especially with local partners in different countries, are really paying off because those partners are there and they're doing a lot of the work that needs to be done. Similarly, I've been kind of dumbfounded to see how possible it is to share technical information through electronic platforms like this particular conference, bringing people together from all over the world. And some of our trainings and technical assistance have been very successful over electronic platforms. And I think that's probably going to, have long-term impacts going forward. Let me stop there. Thank you.
Really helpful. I think that's a really balanced analysis of where cooperation has worked and where we still need to work on and the difficulties of operating when you can't travel and all of the other kinds of constraints. So thank you so much. Julia Spencer from Merck, really look forward to your comments. Obviously, Merck's playing a big role with regard to viruses, and this time around the recent news reports. I'm sure you'll give us some more information about those. So welcome to today's event.
Thank you, Scott. And I want to start off by thanking you and CSIS for inviting me to participate in today's panel. The discussions that we have in these venues and the work that we do together helps to enable the scientists, the public health professionals, and the frontline health workers to do the critical work to address this pandemic. And we applaud their dedication and commitment to patients and their resiliency during these challenging times. And I don't have to tell anyone on this panel that never before in our lifetimes has a global health threat made the need for rapid cooperation and collaboration more apparent. The COVID-19 pandemic is the scientific and global health challenge of our generation, and it demands collaboration from across the scientific community. As a result of decades of global health cooperation in many parts of the world, including many of the examples that we've heard today, a number of infectious diseases have all but disappeared off of our collective radar screen, save for the occasional outbreak as a result of low vaccine coverage rates. However, this pandemic is a stark reminder of the critical role that vaccines and therapeutics play in enabling all of us to work together, for our children to play together and learn together, and for our economies to thrive. As one of the few companies that has continued to invest in both vaccines and anti-infective medicines over the last several years, we at Merck, otherwise known as MSD outside of US and Canada for our friends out in Asia, we know that we have a special responsibility to help advance vaccine and antiviral efforts as part of the overall COVID-19 response. And we have been fully committed to developing an effective response to the pandemic since it was first recognized. And we know that success requires global collaboration among countries and companies and more. As our CEO noted last week, until all of us is safe, none of us are safe. And so, Scott, you've asked us to provide our reflections on some of the strengths and challenges in international cooperation in responding to the pandemic so far. My fellow panelists have done a really nice job of describing some of those opportunities more broadly. So I'll spend my time focusing in on the international and cross-sectoral collaboration toward the development and deployment of new vaccines to address this pandemic. And in terms of strengths, I think all of us are so proud of the near Herculean efforts of the academic, government research, biopharmaceutical, biotechnology, and vaccine manufacturing partners, including my company, who began to work immediately and came together so quickly toward the common purpose of ending the COVID-19 pandemic. The highly coordinated and collaborative global effort has brought industry, public agencies, multilateral organizations, financial institutions like the World Bank, governments, and philanthropy together in an unprecedented way to harness our unique capabilities to develop, deploy, and to administer COVID-19 vaccines. And we partner a lot in industry, but this situation has required that we work at unparalleled speed and really sparing no expense or resources to develop a safe and effective set of vaccines in record time. And as Scott, you alluded to, two examples of the way we're partnering at Merck are the recent announcements that we made of our partnerships with IAVI and with Themis to develop candidates for new vaccines to address COVID-19. Importantly, we looked at the science and we followed the science, and we came up with external candidates that we felt were going to be among the most promising. And so even within our industry, it shows that partnership and collaboration is critically important to advance the best solutions to problems. And, we're also proud of the work that we have been actively engaged in with multi-sectoral partners, including CEPI, Gavi, and WHO, to stand up the new ACT Accelerator that you heard about a few minutes ago. This is another example of unprecedented partnership, bringing together public, private, philanthropy, and technical partners across the entire value chain to really be able to harness all of our financial and human resources, our expertise, and our know-how for this incredibly challenging problem that is in front of us to rapidly identify and develop and manufacture at a scale that no one has done before in the range of billions and billions of doses of vaccines to address this pandemic. And many governments in Asia Pacific as well as APAC as an organization, have also pledged support to this important collaboration. And while all of these advances have been necessary and promising in our cooperation and partnership, we're still at pretty early stage in this journey, and a lot more will need to be done to deliver on the promise of this cooperation to date. And as my fellow panelists know well, the infrastructure, the policy frameworks, and the resources needed for epidemic and pandemic preparedness and response are still at a nascent stage in too many places in the world. Fortunately, as we've heard today, governments and partners across East Asia have answered the call and have provided models of cooperation for effectively responding to this and future emerging infectious diseases. And governments and multilateral organizations like the WHO, which these governments are members of, have and will continue to play a critical role in implementing public health measures to slow the spread of COVID-19 disease and to support the development and deployment of vaccines once they are available. They will also need to continue, as we've heard today, to implement economic and social supports to provide a safety net for their populations. And more broadly, we must all continue to work together and redouble our efforts to advance health security. And with that unity and purpose and collective action, some of the things that we think are going to be critically important to focus on in terms of cooperation and collaboration for vaccine development and deployment are facilitating the rapid development of forecasting models and clear and coordinated demand planning to inform decisions on right sizing of manufacturing and allocation, to be able to encourage national regulatory agency collaboration and convergence across borders, including the development of regulatory reliance approaches. And I think some great work has been done in previous epidemic and outbreak responses, including with Ebola and DRC, in order to bring regulatory agencies together. We also need to identify and address national and regional policies outside of the regulatory space, including international trade, GMO, and BSL requirements that may serve as underlying barriers to the free flow of medicines and of vaccine raw materials and finished products. And we also need to all work together to ensure equitable access to vaccines at a global and national level by supporting the multilateral work and country leaders to align on allocation principles. And at the same time, and finally, we all need to make sure that we are making routine vaccination available during this period with the dual aim of protecting children and adults from the vaccine preventable diseases for which we have vaccines today and avoiding the additional burden on the health system. And again, many countries in Asia stand out as models in these efforts.
Julia, terrific. Thank you so much. It's extremely impressive what levels of cooperation have already started with regard to research and developing responses. I think many of us just watching who aren't in the expert community are depending heavily on this progress to give us a sense of reassurance that we can have a pathway back to some type of normalcy. And so this work that you're leading is really critical. And you also identify an agenda of additional things that we need to do to provide that type of reassurance. I want to turn now to my colleague, Steve Morrison. Steve, you've been around the block a few times with some of these previous pandemics and some other global health crises. And so you're in an excellent position to identify and sort of summarize and touch upon some of the earlier comments about what's worked, where the shortcomings are, and where we need to focus. So in addition to sort of doing an analysis of what's happened so far, sort of helping, following up on Julia's remarks about the agenda of where we need to head would also be particularly helpful. So let me turn things over to you now.
Thank you very much. I assume you can hear me, Scott?
Indeed.
Thank you.
Wonderful.
Thanks, Scott, and thanks, Jude, for putting this terrific morning together. I'm going to direct my remarks to sort of the broad geopolitical consequences of what's happened, and much of it is quite disturbing, frankly. First of all, when you look at the last 6 months and what have the consequences been in the region itself, where you had China engage in a cover-up of the first 6 to 7 weeks, disclosing the virus on the 31st of December to WHO, but a critical period that passed in which spread was possible, that critical period, and then subsequent criticism of the Chinese behavior in terms of delays in declaring an emergency, delays in sharing specimens, delays in allowing the entry of the WHO external scientific group. This has, I believe, driven a pretty significant breach within the region, anger and distrust within the region towards China, and I think that extends obviously beyond the region. So that's my first point, is we've seen a breach within the region emerge in this period. We saw that expressed at the World Health Assembly. Second point is the fact that the U.S.-Chinese confrontation and the unraveling of the relationship between the U.S. and Chinese has unfolded in this same period has engendered a crisis within WHO itself. The sort of level of toxicity and recriminations, and the fact that from the standpoint of the Trump administration, WHO was, in its view, an accomplice of Chinese behavior, and so there's now been a determination to end funding through WHO and to terminate the membership relationship with WHO. And that set off, it's not just a division in terms of the response to the coronavirus pandemic, but it's also had shaped outcomes in the race to get to a vaccine. And I'll say more about that. And one other consequence, I think, in this period that we've seen is an enhanced interest in Taiwan's observer status at the World Health Organization. At the World Health Assembly, the decision was taken by Taiwan to postpone the vote on that until there is an in-person meeting, perhaps in the fall. But there were upwards of 29 countries that openly came out in support of Taiwan on that, and the issue has taken on a new salience and the like. I mentioned that the early phase of China's response became a central source of controversy and tension within the region, but globally and certainly with the United States. The delay in disclosure to the 31st. The genetic sequencing sharing on January 11th, very, very important, very positive step. But those other delays in specimen sharing, delaying of the FIKE, and, of course, the sort of pressure that was put upon WHO in terms of its deference to China in that period. What's interesting about China's response is the Phase 2 response was quite a reversal of fortune. I mean, the 77-day lockdown within Hubei province and the overall national response, you can criticize it from a number of different directions, but certainly there was a strong recovery and impact and effectiveness in that response in that period. We're now in a period in which the Chinese are engaged in a very aggressive diplomatic set of actions at the WHO, at the World Health Assembly, coming out in support of the common good, the common public good of developing a vaccine. Very interesting posture. President Xi speaking by video, addressing the World Health Assembly, and making a pledge of $2 billion of assistance, a dramatic expansion of external foreign assistance, as opposed to the United States position, which was much lower level representation and mostly recriminations against the World Health Organization. What lies ahead now in this next period that's going to test us further? There will be an independent review that was approved by the World Health Assembly. It'll be very important as to who co-chairs that, what the scope and timeline of that independent review becomes. There will be a return to discussing whether the international health regulations need somehow to be reopened and renegotiated. I think the prospects for getting that underway under current circumstances are very low. And we're still going to face the question of what sort of external body can put pressure upon a state that does not disclose, does not abide by or comply with the international health regulations. It's not clear to me that the World Health Organization is where that is going to fall. In terms of the collaboration in the next drive towards a vaccine, there's great uncertainty surrounding that. The estimates of how much capital will be required for the production and dissemination, administration of vaccines vary between $25 and $65 billion, all of that dependent on what type of vaccine, how many doses, and the like. There is no clear playbook on how you bring the parties together in some conciliatory fashion. We certainly have an arms race underway between the U.S. and China, but we have other things like the ACT Accelerator, the EU and WHO, 43 countries coming together on May 4th to raise $7.5 billion towards the field trials for promising candidates. I see that as a very worthy thing. I do think there's going to be increased attention around low-income countries. What are they going to require? Estimates of what they may require on this vaccine run between 8 and 15 billion over a 2-year period. Where's that money going to come from? How is it going to be administered? Global Fund or Gavi Alliance? There's a lot of action underway within the Senate and within the Trump administration on looking at what kind of models of response internationally are going to be the future for the U.S. response. So I'll just stop there. Thank you very much, Scott.
Terrific, Steve, and very good summary and identification of key things we need to look for. I've got 2 questions that I want to pose to the group, some of which I've thought of, and also bringing together some questions that the audience has submitted. And this first one, I want to focus on Steve, Dr. Pangetsu, and Barbara Marston. And then the second question is going to be on vaccines, and we'll turn to Julia from Merck, and then see who else wants to contribute. But on this first one, the three of you, about the WHO or an international organization, Dr. Pangetsu at the beginning said that the WHO is a coordinator, a standard setter, but it can't force countries to disclose. It can't institute sanctions, and we've heard that as well from Steve. And so my question is, what should the WHO's powers and authority be? Should it be given more authority to do these things, or and if it can't, should we be looking to some other type of organization? Should we be creating a new parallel institution, or having other types of organizational innovations to be able to amass those types of authorities to address some of the weaknesses that some have pointed to the WHO's response? So why don't we start with Steve, Dr. Pangetsu, and then Barbara Marston. If we could go, is that okay?
Thank you.
Sure.
Thank you,
just
Scott.
a minute or two for each of you, if you could.
Okay. The central question is, how do we organize ourselves against another novel, dangerous virus that appears in a country and that country fails to comply and that critical time is lost? What do we do about that? I think the idea of giving inspection authority to the World Health Organization is a non-starter politically, and I can explain that their time is limited. I think that it's going to be much more reliant upon independent countries to have much better visibility into what's happening in other countries, and I think you'll see a dramatic step up in sovereign governments investing in whatever they need that they did not have prior to this. Keep in mind, we dismantled our presence, our CDC presence within China, which would have given us enormous advantage in retrospect. So that's one point. There, a independent, empowered watchdog that could put pressure upon governments and upon the WHO would be very useful. We have the Global Pandemic Monitoring Board, which was founded 2017 to play that role, but it's been very weak and ineffectual up to now. I think it's worth revisiting the question of what would it take for that body to have more gravitas and more oomph in its influence. It's very beholden to the WHO and the World Bank, which are its two institutional co-partners. It should consider perhaps being independent and revamping its mandate. That's one option, not the only option. Asian countries could themselves try to group together, but this is a really tough issue. Thank you.
Sure. Thanks so much. Dr. Pangetsu. You need to unmute yourself. Sorry.
Yes, I fully agree with what Steve has said, that I think people need to realize that at the end of the day, WHO is a political organization, and that, the member states will guard their sovereign right at all costs. And unless there's a change in the mandate of the organization in terms of what it should be doing, beyond guiding, advising, setting standards, a major sort of more powerful WHO is going to be an aspirational goal, and that of course is also coupled by the fact that they are very limited in resources. It is not a supranational government that can impose sanctions. So I think you probably know Professor Larry Gostin at Indiana University, who has spoken a lot about what sort of reforms are needed. But really, at the end of the day, a change in the basic constitution and the mandate of the organization is what is needed. And I see that as a very tall order. I've seen it during my years at WHO on the Taiwan issue, just how powerful a single member state, in this case China, of course, will actually stymie any effort from even 20, 30 other member states to admit Taiwan. So it is really about political clout, if you like. I'll leave it at that.
Scott, can I make just one quick comment to that?
Okay.
I think it's important to acknowledge that after the Ebola experience in West Africa, 2014-15, there was a lot of outcry about weak performance by WHO, and there were multiple studies, and WHO strengthened significantly its emergency program. It strengthened its representation within countries. It was very responsive to the many reviews that were undertaken. So we have a recent precedent of where a disaster happens, poor performance, and there's been good things that have come out of that. I also don't think that WHO's performance in this period has frankly been anywhere near as bad as it's been described by the Trump administration. It's actually been pretty damn good in many, many key respects.
Thank you.
Thanks, Steve. Let me turn to Barbara now. What would be at the top of your wish list, Barbara, from your perspective about ways in which either the WTO could be reformed or we could find additional type of institutional architecture internationally?
I might be going a little beyond my expertise on this, but a couple of thoughts are, one, if you think about carrots and sticks, I think if you punish a government for non-transparency, what you end up punishing is the citizens of that country more so than the government, and you have to keep that in mind. And even though it's nowhere near perfect, I think the carrot side of this is a little bit appealing. So if countries really can see the benefits of early disclosure and transparency, I think there tends to be this idea that we want to hide it. It's almost like we want to pretend that something's not happening, but eventually it comes to light. And then if you can show that, letting it come to light early really leads to better responses and better outcomes over the long term, that might be a more effective approach.
Terrific. Thank you. That's very helpful. All right, let me turn to the second question. And this might be the last one given where we are in terms of time. I could sit here all day because my learning curve hasn't begun to flatten at all. And I really appreciate what everyone is saying. It's extremely helpful. But I want to look at the therapeutics and the vaccines and then start with Julia Spencer from Merck. And realistically, what's the type of timeline that we should be thinking about with regard to therapeutics and a vaccine or multiple vaccines and cost structures, delivery, and where do you think international cooperation could be more intense to accelerate the timeline? Obviously, we don't want to go too fast because we don't want to have something that causes lots of damage, even if it addresses the virus itself. But could you give us some sense of what we ought to think about in terms of expectations?
Yes. So again, I could sit here all day and I think, talk about this set of really complex issues. I think maybe I'll first go to your question about, balancing speed with getting something over the goal line. And certainly we learned a lot with the development of our Ebola vaccine, where, the clinical trial work was actually done in an accelerated manner, unprecedented timelines, and with a lot of partnerships from organizations like the US CDC and NIH, the WHO, and other governments. And yet, because of the time period that it takes to pull together clinical data, to be able to put together regulatory dossiers, and with vaccines, you license the product, but you also you license the manufacturing facility. And so you actually have to show that you're producing quality, effective product over and over and over in order to be able to get a licensed product. And that takes time. And so there are ways that we have and will continue, I think, working with regulatory authorities and our manufacturing organizations to accelerate that to the extent that you can. But there are hundreds of quality tests that have to be done for every batch of vaccines, which is a good thing because it is a biological product. But I think, it would probably be unrealistic to say that you're going to have, billions of vaccine doses this fall. I think, it's more realistic to say that that might be something that's possible next year. But what we will likely see is a kind of phased approach to vaccines being developed and licensed and manufacturing scaled up to be able to deliver the global demand that is going to be needed. All of that's being done at risk. And the other thing that we've learned in other epidemic and pandemic situations is that the epidemiology changes over time, and thus the need for a certain volume of vaccines in any given geography also changes over time. And that's why the critically important work through the ACT Accelerator that WHO is leading on allocation and prioritization and modeling is so critically important, so that we understand what that manufacturing capacity needs to look like when, and we also understand how that might change over time with this dynamic situation with the outbreak. I think the other thing that I wanted to mention is that we have to balance a target product profile, or TPP, as we say, which is kind of the perfection of what anyone is looking for in a vaccine, with the speed with which we need to develop something and get it out there. And again, with our Ebola vaccine, we used a platform that we had, and that meant that, for example, the storage of that vaccine was at a very, very low temperature. But as we are now evolving our understanding of that platform, being able to evolve and improve the vaccine candidate that we develop for SARS-CoV-2, and that will, again, happen over time. So perhaps the first vaccine that's licensed isn't the perfect vaccine. Maybe it's a 2-dose, and the second one is a 1-dose. Maybe the shelf life is longer for the third one. And so I think we have to appreciate that this is going to be a continuum of innovation, and that there will be multiple needs for vaccines to address this issue, and that we all are working as quickly as we can to get the first, second, third, fourth, all of which are going to be needed as quickly as possible to licensure and scaled up manufacturing.
Perfect. Thank you. Do any of the other panelists want to comment on this question? I'd be happy to give you a brief moment to respond. I see Steve's finger up, but others are welcome to comment as well.
Shall I speak?
Go for it.
Okay. Thanks so much, Julia. We're going to see in this next phase, I think it's fair to say, there's going to be a need to deal with uncertainty, delays, a lot of patience going to be required, and there's going to be quite a bit of tension and controversy around the actions taken. There's too much at stake. This pandemic is affecting the entire planet. The scale required for this vaccine is unprecedented and vast. and nationalism is a deep and abiding force here, but it's in tension with the sort of broader common public good approach. Equity, fairness, access, transparency are going to become sort of the common terminology around all of this. Also, the other point I'd make is it's interesting that industry and their partners are going to have to put in place warm manufacturing capacity that moves ahead very expeditiously with vaccines even before we know whether they're the best, the safest, and the most efficacious. This is a very inefficient and costly process we're heading into.
Any others want to? Yes, Dr. Pangetsu.
Yeah, just very quickly, I think the other challenge I foresee with the implementation of the vaccine is the ongoing phenomenon of vaccine hesitancy that has affected many East Asian countries. And I think that's a factor that shouldn't be underestimated because it's created a lot of problems with measles vaccination, as you know, and also with a more recently developed vaccine against dengue fever. So I think that's something that needs to be taken into account.
Thank you very much. This has been a terrific discussion. The panel really has identified areas where we are working well together. Governments, the private sector, philanthropic organizations, but where we need to do more. The entire morning has really been terrific. We know what works in responding to pandemics. We've seen examples from South Korea, Singapore, Taiwan. We didn't discuss Vietnam, but Vietnam's not had at least a reported fatality from this. And a lot of those successes come through very difficult lessons of previous pandemics, which has then led to building up of capacity and implementing to carry out a whole variety of measures. At the same time, we also now have a clear road ahead for how to respond to this pandemic and what needs to be done. There are obviously some significant challenges at individual government levels, some in specific institutions, and as we've also discussed, the U.S.-China rivalry is having an effect on how we've responded, and it still could in the future. For example, we want to make sure that even once a vaccine and therapeutics are developed, that there's no limits in accessibility because of that rivalry. And so there's a lot of work still to be done, but I think we now know what the agenda is. And so I leave the event this morning more optimistic than when I began. And for me, anyone who knows my views about where we are in U.S.-China relations and other issues, to make me optimistic, you've all achieved quite a feat. So I want to thank you all for contributing this morning and enlightening us about the domestic responses and international cooperation with regard to the pandemic. I want to thank TECRO for its support of this program, our staff here at CSIS in the Trustee Chair and in the Freeman Chair who've done a terrific job putting things together over many weeks, and the rest of the CSIS team, the AV team, for support today. The full video of today's event will be available on the CSIS website from this event page in just a few minutes. And as you know, CSIS, through the work of Steve, Victor, Jude, Anna Carroll, many of our colleagues, we are focused on this like a laser beam on the science, on the international politics, economics, and so you will hear more from us as well. I want to, again, thank everybody for really contributing to a fantastic discussion today. I want to wish everyone, wherever you are, have a good evening, have a good morning, and stay safe. Thank you so much.
Thank you. Thank you.